Hi guys, welcome back to the channel. Last class we have finished Paget's disease. We'll be starting with osteopetrosis. Okay, let's start. Osteopetrosis caused by inherited defect in osteoclast. Osteoclast में defect होता है. Defective osteoclast fail to resorb bone. All bone progressively become more dense, less cellular and less vascular. So what happens in osteopetrosis? That there is defect in osteoclast, inherited defect in osteoclast. So that defective osteoclast fail to resorb bone. Therefore, all bone progressively become more dense, less cellular and less vascular. Because the resorption remodeling cycling of the bone eliminates micro stress line and micro fracture and maintain foramen and marrow cavity spaces, these areas become compromised and compressed in osteopetrosis. Okay, all these areas will become compromised and compressed in osteopetrosis. Now, therefore, fracture, anemia, thrombocytopenia, hepatosplenomegaly and nerve dysfunction ranging from hearing loss to visual disturbance to facial palsy are possible. 3 inherited pattern. First is severe autosomal recessive osteopetrosis, also known as Albers-Kornberg disease. Albers-Kornberg disease, that is autosomal recessive. Second is mild autosomal recessive, that was severe, this is mild. And last is benign autosomal dominant osteopetrosis. There is severe autosomal recessive osteopetrosis, mild autosomal recessive osteopetrosis, and last one is benign autosomal dominant osteopetrosis. 3 inherited pattern of osteopetrosis. Often have varying amount of exposed bone with granulation tissue and a secondary low grade osteomyelitis in the head and neck region. Exposed bone होता है with granulation tissue and low grade osteomyelitis. Okay, what happened in early cases and what happened in long standing cases? In early cases, increased radiographic density seen in OPG or skull radiographs. Unerupted teeth are present. Cervical spine radiograph, the vertebra appear to have sandwich look. Caused by an increased density in superior and inferior cortices in contrast to less dense cancellous marrow area between them. तो एक एरिया मोर डेंस है, एक एरिया बीच वाला एरिया लेस डेंस है, तो इट विल अपेयर एज अ सैंडविच. Cervical spine radiograph. Now, in long standing cases, individual has undergone well intentioned but ineffectual bony debridement and tooth removal. Most of their alveolar bone missing from the past debridement with a pathological fracture. Exposed dense and disorganized bone is common and almost always follow tooth extraction. Erupted teeth may be ankylosed. ठीक है, there is exposed bone. Now, cutaneous fistula and facial cellulitis is also seen. Defective vision and nystagmus are common, where a varied group of paresthesia, anemia and thrombocytopenia but uncommon. Okay. Long standing cases. So we have seen मतलब unerupted teeth दिखेंगे और इंक्रीज रेडियोग्राफिक डेंसिटी दिखेगा. सर्वाइकल स्पाइन पे सैंडविच जैसा अपीयरेंस आएगा. देन बोनी डिब्राइडमेंट एंड टूथ रिमूवल विच आर इनएफेक्टिव. then we'll see pathological fracture, alveolar bone is missing, then it is exposed there, dense disorganized bone. Will we appreciate cutaneous fistula and facial cellulitis and defective vision and nystagmus. Now coming to this differential diagnosis, bisphosphonate induced osteonecrosis, will be dealing with this in the next class. That is clinically it also appears same. Both have exposed bone. Florid cementoosseous dysplasia, later stage of Paget's disease, fibrous dysplasia, OPG में both appears same. बोनी चेंजेस सिमिलर इन सीवियर एनीमिया, सिकल सेल और थैलेसेमिया। और जो सिकल सेल और थैलेसेमिया में बोनी चेंजेस होते हैं वैसे ही बोनी चेंज ऑस्टियोपेट्रोसिस में दिखते हैं. That's all for today's class. We'll be continuing osteopetrosis in next class. Till then, like, share, subscribe and comment. Bye.